Hi everyone, my name is Pam, and I'm here to present to you about coccidioiomycosis, or typically known as valley fever. First of all, I shall begin with the question, what causes the disease? We know COVID is an infectious disease caused by virus, so you may guess that virus is the cause of this disease. However, virus is not the only bad guy here. It has friends, and one of its friends is fungus. The name of this cute-looking fungus here is Coccidioides. Although it's cute, I would not recommend anyone hang out with this fungus because it's the culprit of this volley fever. In rainy season, the Coccidioides lives in soil and produce airborne spores, and when a person inhales those spores, that person may get sick with the volley fever. And I say may because most people who inhale the spores don't get sick, but they all get infected. It's just that people who get sick usually get better on their own within weeks or months without any symptoms. Here's one of the most common species that causes the valley fever. It's called Coccidioides immitis. Coccidioides is a dimorphic fungus with a saprobic phase, consisting of mycelia in the soil and a parasitic phase from inhaled Arthoconidia, resulting in infection in host. And when the host dies and the dead body gets buried, the soil can be reinfected in cycle. Like I said at the beginning, many people who are exposed to the fungus don't get sick, so they never have symptoms, while others may have symptoms that go away on their own after weeks or months. The symptoms include fever, headache, cough, shortness of breath, chest pain, muscle pain, and joint pain. A rash on the upper body or legs is a common symptom as well. See here on the map, the red and yellow spots indicate the area where the valley fever is present. Coccidioides live in the soil in the southwestern United States, south central Washington state, and parts of Mexico and Central and South America. About 15,000 cases are reported in the United States each year, mostly from Arizona and California. Now we shall ask, how is the infection spread? We already know that to get the disease, a person inhales the airborne fungal spore present in soil and dust. So, can we say that this disease is contagious? The answer is no, because the valley fever does not spread between people or animals. It's the fungus that causes the disease. And what happens after the fungus gets into our body is that it will damage our lungs. The lung nodules are the result of pneumonia caused by the valley fever. And what are the nodules? Nodules are small residual patches of infection that generally appear as single lesions, typically 1 to 1.5 inches in diameter. Patients who have no symptoms, as well as patients who do have symptoms, may develop nodules. Symptoms of valley fever usually appear between 1 to 3 weeks after infected. In many people, the symptoms will disappear in a few weeks. However, in severe cases, the infection can cause chronic pneumonia and the symptoms can last for years. Coccidioides immitis is the most virulent of the primary fungal pathogens that affect humans and other animals. As such, it is the only fungal etiological agent with a Biosafety Level 3 designation in BMBL, or Biosafety in Microbiological and Biomedical Laboratories. BSL-3 lab deals with infectious agents that may be transmitted through the air. Ventilation inside a BSL-3 lab is controlled via a filtered ventilation system. Again, for many people, the symptoms of valley fever will go away within a few months without any treatment. However, for those who are at higher risk for developing severe valley fever, they may be prescribed for antifungal medication. The treatment is usually 3 to 6 months of fluconazole or another type of antifungal medication. People who have severe lung infections or infections that have spread to other parts of the body will always need antifungal treatment, and the treatment lasts longer than 6 months. It is rare for a fungus to spread to other parts of the body, but if it happens, it can be very serious and fatal if not treated. In severe cases, valley fever can develop into chronic pneumonia or meningitis or infect bones and joints. Here comes the question: can it be cured? The answer is yes, it can. But there are no over-the-counter medications to treat valley fever. Valley fever has appeared since 1892, so there may not be many current research of the disease. However, in the light of COVID-19 pandemic, according to the information from National Institute of Allergy and Infectious Disease or NIH, new concerns are raised about the risk of viral and fungal respiratory co-infections. At present, it is not yet fully understood how cocci and COVID-19 infections interact, but concerns have been raised about overlapping risk factors, the severity of co-infections, and diagnostic and surveillance challenges. And that's a wrap. Thank you guys so much for staying until here. Have a nice day. Goodbye.